Welcome everyone, and thank you so much for joining us for this Care Center Q&A. My name is Jeffrey Harden from the Cystic Fibrosis Foundation Delaware Valley chapter, and we're so glad that you can join us. We just wanted to go over a couple of quick ground rules for today's chat, and then we have a great panel of experts that are going to share some information, and then we're going to open it up to your questions. But you should feel free to submit your questions into the chat at any time so that they're already there and ready when we get to that section. So as pertains to your questions, we did want to encourage you to not ask individual patient-specific questions. We really refer you to the one-on-one conversations with your care team for that. This conversation is being recorded, so please phrase your question as a general point that could pertain to the CF community. And everyone joining other than our presenters will be muted throughout the presentation so that we can make sure that we can see and hear them. And for your own privacy, we encourage you to right-click on your display name and change it to first name only if you so choose. So that's it for our ground rules. And with that, I'm going to hand it over to Jessica Wickersham, Executive Director of the Delaware Valley Chapter.
Thanks, Jeffrey, and good afternoon, everybody. I'm so proud and excited to introduce our panel this afternoon. All of these ladies are at the top of their professional game and are true aspects to our community. So first, we have Dr. Laurie Varlotta. Dr. Varlotta is the Center Director at St. Christopher's Hospital. T. Moschberger, and T, I should have written this down. I don't know your exact title, but I'm going to say Mental Health Coordinator at St. Christopher's. Right. Is that right? Awesome. And then from the Foundation's Compass program, we have Yamini Saxena, who will be able to speak more to Compass and the different opportunities that exist within Compass to help. So with that, I will turn it over to Laurie, and thank you guys so much for being here. It's going to be a great presentation.
Thank you so much for having me again. And I did one of these town halls back in April. So with that, I'm going to just go over, everybody's seen this picture before. It's a picture of the coronavirus or COVID-19. And next slide. So we know, let's go over what we do know. We know that the incubation period for this coronavirus is anywhere between 2 and 14 days, and that can differ among kids and adults. So kids sometimes don't get symptoms until later, more like 10 to 14 days. The adults, more like 2 to 4, maybe 5 days. But there's wide variation of that. That's just a broad generalization. Another broad generalization is the way you get your symptoms. So actually 80% of people don't have any symptoms at all, and or they have very mild symptoms. And everybody has heard about some of those: lack of taste, smell, cough, things like that. 15% are actually require hospitalization. 5% are very ill. And we also know that we didn't know back in April that kids and adults are very different in the way they present. So children can present with fevers and fevers that last a few days, have rashes, funny rashes, swelling, things like that, where adults, a lot of times they get more, they can either get the stomach issues, diarrhea, things like that, but most of them really present with the respiratory or the lung problems. Next slide. What we didn't know in the first town hall is how it would affect people with CF. So we do have some statistics now that I'd like to share with you regarding people with CF and COVID-19. So, and this is from the CF Foundation registry data back in just August 20th. So we as care centers actually get this information almost weekly. And we can see that there were over 4,000 tests conducted for COVID-19 on individuals with cystic fibrosis. Of those, only 170 have come back confirmed positive cases. And actually, if you look at it even a little bit more, of the positive cases, only 53 are pediatric. So 117 would then be in the adult group. Of the 170 patients, only 43, 10 of which were pediatrics, were hospitalized. And then if you look even further, people that have advanced lung disease, pretty sick lungs, only 22 of those people actually had COVID. One, unfortunately, advanced to death. And if you look at patients with lung transplantation, only 6 have confirmed positive cases. Next slide. That actually is very different than, if you think about it, the general population and all the statistics that you hear on a daily basis in the news. So next, what else do we know? Well, there's a lot about vaccines we don't know, but we do know that there are quite a number of studies that are happening at this time. And we actually, some of the first clinical trials in people are just started this week in the United States. But what we do know is that the CF Foundation has established a working group to actually monitor vaccine development. And they're advocating for the unique needs of people with CF related to development and distribution of the vaccine when it becomes available. So that's something very important to know. Next slide. But what do we know and how do we know, how can you stay healthy? We do know that hand washing and hand sanitizers work. We know that. We do know, and there's a lot of controversy around masks, but we do know that masks do work. Masks not only work to prevent the spread, but prevent you from actually getting it too. So masks work both ways, and there unfortunately has been a lot of discussion about masks within the United States, but masks, as you know, do work. And if you look at the way the picture on the right of the slide, you can see why masks and even social distancing does work. And social distancing we know works too, because 6 feet apart. That's the mantra of the CF Foundation. So 6 feet, we do know, is the distance needed between people so that you don't spread any bacteria or any viruses, including the coronavirus. So we do know these are ways to keep you healthy. So let's talk about now school. And we talk about back to school, and we use it kind of loosely, but this is inclusive of all ages, of all grades. So it could be from preschool to daycare through actually college and even going back to work and doing it's inclusive of all activities outside the home. And what we do know is this is a very fluid process, and we need to sort of understand what's happening. But it also includes sports and some of the sports teams. So there are some people that are having sports and others that aren't. So next slide, please. So we know that this is going to be a very active process. There's all different kinds of versions of how schools are opening, and the different school districts have different options. Some are completely virtual, some are in person, some are actually a hybrid plan. Some are actually not even, they're virtual till the first marking period's over, and then they're going to reevaluate. So this doesn't make it easy for anyone, but we just know that we have to be flexible. You should also know what's going on besides the school districts, what's going on in that environment, in that classroom. How is it going to look? What's going to happen? But you also have to know that it's not going to be perfect, and you have to encourage that you speak up or even your child speaks up, and that we keep everybody as safe as we can. The one thing that we do know, whether it's virtual or hybrid plan, we know that you need an IEP or a 504 plan in place because things happen. And that's where you can, again, advocate for yourself or your child. Office of Disability is actually within the colleges, human resources within your workplace. And there are some people that actually do part-time school, part-time college, and part-time work. So all these are going to be people and areas that have to be tagged and involve us. We're here to help. We're here to actually help you and your child make this the best sort of process that we can and to make it as safe as possible. Next slide, please. But we know that things can change, and first things open, then they close, then it makes everybody a little crazy. So don't bank on one thing and it's staying that way. Things will change. The school can change its mind about things. Your kid may not be, or you may not be, that might not be the best situation. And your area and state can actually change. So we just need to be flexible as much as possible. But there's also a lot of good information on websites about COVID and families of children and youth with special health care needs on the American Academy of Pediatric Parenting website. And the CF Foundation has an excellent area at cff.org where you can get a lot of questions or related resources, or even probably ask questions. Next slide. And this is just a snapshot of what the CF Foundation website is. And you would actually go on the bar, on the top bar, it says the second one in, Life with CF. If you click on that, and then Daily Life, and you can see down towards the bottom, just above COVID-19 Community Questions and Answers, you can actually see exactly where you can go on the CF Foundation website. So Life with CF, Daily Life, germs, and staying healthy. And then there's a link for CF and COVID-19. So thank you very much. I will now pass it over to T. You're muted. T, you're muted.
Sorry about that. Thank you for having me, guys. So I know this has been a difficult time for everyone, and I hope to just provide a little bit of guidance to help navigate yours and your child's mental health needs as they return back to school, whichever way that happens. So I'm going to go over just a couple tips for virtual learning, how to identify when your child might be struggling, and where and when to seek help. Next slide. So first things first, as Dr. Varlotta mentioned, we really don't know how things are going to progress over this year. And it's really important not to make promises like things will get better or more normal, or don't worry, you won't be virtual all year. It's just temporary. So the truth is we really don't know what's going to happen. And thinking back a year ago, none of us could have predicted the virus impacting our daily lives the way that it has. And I think we need to be truthful with our children that we still don't know what's going on. So kids can have really concrete thinking. And if you don't tell them kind of what's going on in their world and in their school, they will come up with those answers themselves. And often we kind of shy away from telling kids what's going on because we worry that their anxiety is going to spike or they'll get more worried. But by giving them appropriate and safe language about what's going on and what could happen, you're actually helping decrease that anxiety. So we want to talk to our kids in realistic terms. Now, I do that in quotes because we really don't know what is reality. It's all unknown. But talking to them about how their schooling could change, their activities, your job, their job, that we hope that things are going to continue to move forward and go back to normal. But even when things are more normal, it might not look the same as it used to. So talk to them about the possibility that things could change at any given point. So one of the ways to decrease that kind of spike in anxiety about the unknown is to have a plan. So discuss with your child how you're going to handle any potential changes. So if suddenly their school is going back in person full time, you want to talk about, we have a plan, we have our uniforms ready, we have our school supplies, our lunch boxes, hand sanitizer, we are ready when the school is ready. And also talking to them, if there were a more strict quarantine put back in place, we already know what to do. We know how to get our medications. We have lots and lots of toilet paper, or a plan for more long-term virtual learning. So, but just remind your child that you are there to keep them safe. You are there to make sure that all of their needs are met and that you're going to do that as a family. Next slide. So the learning environment. So when we all went into quarantine and into virtual learning in March, there was really not much preparation at all. Teachers, families, we didn't know kind of what this distance learning was going to look like and how to adapt to that. So everyone was scrambling to get things together. But now that we have a little bit more planning time, this is our chance to really kind of do it the right way, if there is a right way to do this. So the most important thing that you can do for your child's mental health during virtual or distance learning is to have really clear physical and emotional boundaries around school. So you want to help them create a special space where they can do their schoolwork at a desk, somewhere private, somewhere where they are able to get all of their learning materials, posters, paper, whatever they need within reach. And by having that dedicated school space, your child is able to sit down and come into the mindset of attending school and be able to walk away from it. So if you find that your kid is doing their work at the kitchen counter, on their bed, on the couch, there's really no separation from home life and school life. And we need to be able to walk away from that in the same way that anyone who is done working from home needs to do that as well. So keeping a schedule is really important. You want to go to bed at the same time, wake up. I don't know about you guys, but I know that when this quarantine happened, my sleep schedule was shifted. I spent a little too much time in my PJs, and things kind of got all jumbled up. So by having all of those set boundaries in place of getting up, getting dressed, having your lunch at a certain set time every day, your body naturally will be in that routine, and you'll have a much easier transition if and when they do go back to school. So another important aspect is to really kind of give grace to each other. This is really stressful for your kids and for adults, and I think we're all struggling on what we've missed out on. The summer is coming to an end. A lot of us have missed out on beach trips or vacations or just being able to play on sports teams, and I think it's important to recognize that we are allowed to have big feelings about it, and your kids are allowed to have big feelings about it. So give each other some grace when we have meltdowns, because we all will, and that's okay. But validate their losses. Some of them are missing out on things that they can never get back, opportunities they can never get back, and that's a big loss, and it needs to be acknowledged and grieved. And then lastly, ask for help. So if your child is struggling with e-learning or a rotating schedule, talk to their school counselor, their teacher, a friend, Facebook groups. Don't struggle alone. There are families all across the country and all across the world who are going through the same thing, so reach out for support. Next slide. So virtual learning hacks, you really want to consider the space that's visible to their teacher and peers. So by doing distance learning, a child is really letting all of their peers and teachers into their home. Even though it's virtual, it can be very vulnerable for people who maybe have a more difficult home life or a more difficult school life, and it can just really produce a lot of uneasy feelings. So you want to find a space with a neutral background, and not everybody has that kind of space, so you can consider getting a trifold, like a science experiment board that you can set up behind them to create that blank space for them. Another important thing is to be really active in their self-care plan. So what I mean by that is having a written list of things that they can do. Sorry, can you go back one slide? Thanks. So having a list of things that they can do to help them with their self-care. So might be shooting hoops outside, going for a walk, doing a puzzle, building a Lego set, helping with dinner every night, something that helps them unwind, because it's really easy to get stuck into just looking at more and more screens during our off time, going through Facebook or different tablets and video games, and really taking a break from that to unwind is a really good way to treat your mental health. So I know that I've said that having a set learning space is really important, but it's also important to have plan B and plan C. So maybe their setup is in their bedroom and they're working, but their child is having a really hard time paying attention and they need a little more support from you. So have a set place of, okay, if things aren't going well, you're going to move out here where I'm doing my work so that I can support you. And alternatively, if you have any kind of area that maybe is near a window you could open as the weather gets nicer, or even like a patio or outdoor space where you can still get Wi-Fi, that might be a nice treat to break things up as well. And set limits on your devices for social media and just for use of your electronics. So I know within your phone, within a lot of websites, you can set limits, and you can actually go back and kind of look and see how much time you've spent on certain apps each week, and it's incredible how quickly that time adds up. So being mindful and actually setting those time limits so that your phone reminds you that you've had your allotted time for the day. Next slide, please. So keeping an eye on mental health. One of the new things that's come along with distance learning is a new type of bullying. So we've noticed that kids, because you can only see this little square box around each kid, you can't see what's going on around. There have been instances of kids making fun of each other or taking videos of certain classroom activities. You know, we've all had the Zoom meeting, oopsies, I didn't mean for everybody to see this or that. Kids being made fun of for the cleanliness of their house or their family members, pets, siblings being in the background. And so talk to your kids about that could happen, or ask them if they've ever seen that with any of their other kids in their class. Avoiding doom scrolling. So if you've never heard of that, that's where you get kind of stuck in that cycle of watching news videos, Facebook, anything that is negative, and you get stuck in that wormhole of just watching everything that's going on in the world that's not good, everything that's bad, and you get stuck in that. And I'll tell you, that is probably the worst thing for your anxiety, for feelings of hopelessness. So keeping an eye on doom scrolling. Also, stress is contagious. Especially kids can feed off of our energy, and we know that we're all stressed out, anxious, and just having a difficult time with change. So keeping mindful that how you deal with your mental health and how you manage that affects how your kids will manage theirs as well. But especially during a time when parents are now having to be the teachers, the daycare workers, doing their own work from home, and all these different things, there are more instances of arguments and trying to get your kid to pay attention to their school and did they do their schoolwork. We just want to make sure that your interactions with your children are balanced. Do you have as many positive interactions as you have difficult interactions? And every day is going to be a little bit different, and not every day is going to be perfect, but overall, we want to try and balance out those interactions so we're having just as many positive, loving interactions as we are difficult ones, if not more loving interactions. So actively talk with your child about mental health. How are they managing the stress? So instead of just saying, how have you been doing with all of this? You can say, I know quarantine and virtual schooling can be overwhelming. Does it ever make you feel sad or angry or lonely? By using those feelings words, you're really incorporating the mental health into the conversation. And if you don't know how to use those types of words, or your child doesn't, there are lots and lots of feelings charts you can print out online and use them to ask about their day. And being a role model for them is a really important aspect. Go to sleep at a decent hour, get up, get ready for the day, keep your work area tidy, eat lunch at the same time. Everything we're asking our kids to do, you want to do yourself so that they can see you modeling that. Show them how you manage your self-care. How are you handling a stressful day? And use those feelings words to describe how you are dealing with everything as well. Next slide. So here's a list of symptoms of concern. So if you start to notice that your child's behavior or mental health has been changing, seek help. Talk to their teacher, their school counselor, their mental health coordinator on their CF team. Keep them in the loop if they're having a hard time. There are a lot of mental health resources available, and I know that nobody wants to add even more Zoom sessions and video chats to their already busy workload. But there are so many therapists and school counselors and social workers who are doing counseling sessions virtually that they can provide during all of this pandemic. If you need help finding one of them, your mental health coordinator and your social worker are a great place to start. You can also ask your pediatrician or even call your insurance company. Next screen. So lastly, here's just a list of resources and access to treatment. It's important to just be aware that a lot of kids don't want to talk either on the phone or on Zoom about what's going on if they can't be guaranteed privacy. If you live in a small apartment where your kid doesn't have the option to talk out loud about their feelings to a therapist or a counselor, there's some really great online resources of like online chats and text lines. So it's important to talk to your kids and let them know that those exist and how to access them, even if you don't think they'll ever use it. Give them that knowledge that it exists, because when they're having a difficult time, they know how to access it. Or if they have a friend that comes to them who's having a difficult time, they know how to share that information. All right, and now I'm going to pass things off to our Compass leader, Yamini.
Thank you, T, and good afternoon, everyone. And thank you for inviting me to your town hall. I'm really excited to present about Compass. Let me begin with introducing myself. I'm a senior specialist with Compass, and I've been with the foundation for almost 10 years now. And for those of you who are less familiar with what Compass is, what we do, who we are, and I'm here to provide you a brief overview and also how we have helped families during this pandemic. Next slide, please. Okay, so overview our Compass services. So we are a team of case managers. We call ourselves our patient advocates, and we provide personalized one-on-one services to help you navigate insurance, just understanding and getting insurance coverage and benefits. We can help you evaluate insurance options if you're uninsured and you want to find out you're eligible for Medicaid, or if you're eligible to enroll in a health plan through the marketplace, or if you have a child who's aging out of dependent coverage, who's turning 26 and you want to know what the options are, or you may be newly eligible for Medicare and you want to know what the options are in terms of Medicare. Or if you're switching jobs and you need help comparing employer health plans, we can help you evaluate those. We also help you with adverse coverage issues. So if you're prescribed a drug that's not on your plan formulary, what do you do? Or if your CF doctor or the care center is out of the network, so we can help you navigate that. Financial, we help you find resources to pay for medications, therapies, and other costs associated with CF. We know CF is expensive and most families have a very high out-of-pocket costs related to CF care, so we can help you connect with financial assistance program. These could be through the manufacturer or disease-based foundations that can help you pay for your costs related to CF. legal families also call us because they want to understand what their legal rights are for someone living with a chronic disease at workplace or school, or they want more information on topics like Social Security disability benefits or government benefits. So we can connect you with legal resources to help you obtain information, including the Cystic Fibrosis Legal Information Hotline, which is actually administered by Beth Safian. She's an attorney at law and she herself has cystic fibrosis. And we can also help you navigate with other complex issues, these just related to day-to-day life. This is a very broad area of service. People call us because they need help with rent, utilities, or they're looking for scholarships for their child who's entering college, or they need transportation assistance to their CF care center. So we can help you in many ways. Next slide, please. So how can you contact Compass? There are 3 ways you can contact Compass. We have a dedicated toll-free number, 844-266-7277. For the summer, our hours of operation are Monday through Thursday, 9 a.m. until 7 p.m. Eastern Standard Time, Friday, 9 a.m. until 3 p.m. Eastern Standard Time. And after September, we are going to resume our normal work hours, which would be Monday through Friday, 9 a.m. to 7 p.m. Eastern Standard Time. You can also email us at compass@cff.org. And you can submit an online form, which is available on our website, cff.org/assistance services Compass. You can submit your inquiry via online. And recently, actually, we started a very new feature, which is live chat. So you can interact real time with a case manager through a live chat on any of the foundation's Compass pages where it says Connect with Compass. Next slide. So I wanted to introduce to our Compass case management team. So these are members of our Compass case management team. We are 16 in all, and we are spread out across the country in Maryland, Pennsylvania, Delaware, Texas, Colorado, and Minnesota. And this just allows us to build expertise in our local areas. And the case managers that have a star, these are bilingual case managers. So they're fluent both in English and Spanish. And we also have language line that can assist with 240 languages in case you are comfortable with any other language other than English and Spanish. Next slide. The Compass and COVID-19. So I just wanted to take a few minutes to talk about COVID-19. We are in the middle of a pandemic, and this has been most concerning for CF families. And so Compass has handled over 600 COVID-19 related calls. In Pennsylvania specifically, our team has worked on 29 cases. In the beginning of the pandemic, which was around March, most of our inquiries and questions we receive are mainly related to risk of exposure to COVID-19 in public settings such as school, work, clinical appointments, grocery stores, etc. We also got requests for supplies such as masks, gloves, hand sanitizers due to fear of supply shortages. Unfortunately, we are not able to provide any personal protective equipment. CF families also contacted us with questions around work accommodations and legal protections as people lost jobs and their incomes, either because they were laid off or furloughed, or they were essential workers themselves and could not work due to risk of exposure to themselves or a family member with CF. These families wanted to know what their options are for unemployment benefits or paid leave under the new COVID-19 laws, or leave of absence under Family Medical Leave Act or American with Disabilities Act, or including options for requesting accommodations for remote work due to an underlying health conditions. So we continue to refer the CF community to legal resources to help them understand their rights regarding employment benefits. We make referrals to many resources, including the law offices of Suffian and Passamano. They are the ones who administer the Cystic Fibrosis Legal Information Hotline. A Better Balance, this is another non-for-profit organization where you can virtually connect with a legal expert for free. And they have expertise on employment laws and disability related issues, and including the Job Accommodation Network. This is a service that is provided through the Department of Labor, Office of Disability, and they provide guidance on workplace accommodations and disability employment issues. As we moved into July, we started to see a shift in the needs of the CF community. Families started reaching out more for assistance with living expenses, including food, rent, and utilities. People are also contacting us with questions regarding telehealth access and coverage as CF care is shifting to virtual options. I just want to highlight that we do have a program that provides home spirometers to people with CF. This is available through their CF care centers to help support these virtual appointments. And most recently, as schools are reopening, we are receiving requests for school accommodations and legal protections under the education laws that protect children or people with disabilities, including the 504 or IEP plans. CF Foundation has provided template letters to help care teams in requesting remote learning or school accommodations for their patient population. So these are some of the ways we have helped people or families during the COVID-19. Next slide, please. So I just want to highlight a couple of cases we got during the COVID-19, family needing, helping, affording with food. We had a call from a mother of a child with CF and she was needing help with food. So our case managers, while evaluating her, realized that she would be actually eligible for the SNAP benefits. So we helped the family understand what SNAP benefits are and also how to apply. The case manager also did additional research and connected the family to a local food pantry. Another family needed help paying rent and utilities. The mother had 2 jobs, and because of COVID-19, one of her jobs was closed, and she was only able to make 1 job. She needed help paying rent and utilities. So again, we were able to provide her 6 resources through her local community organizations that could help pay for rent and utilities. The case manager will be following up with this family to make sure the resources we provide actually worked for the family or if they need additional assistance. And third, we have had an adult with CF who was terminated from job, and she wanted to know, due to disability, and she wanted to know what her legal rights are and information on discriminatory practices. So we referred her to the CF Legal Information Hotline and also A Better Balance that answers questions related to disability and employment laws. Next slide. So with that, we conclude our presentation, and I hope it was useful in knowing how we can help families during this challenging times. Different ways, and the only thing I would add is Compass is a very valuable resource for families with CF, and I hope you will be able to contact us. We've made contacting us very streamlined. You can contact us via email, you can go online and submit a service request form, or you can even live chat with a case manager. Thank you.
Well, thank you, Yamini, and thank you, T and Dr. Varlotta, for that great informative presentation. And now we're going to move into our Q&A. So everyone who's joined the call, feel free to submit any questions that you have via the chat. And if you are on the phone, you can go ahead and unmute your phone and ask your question. There aren't any questions in the chat yet, so I'll start with a question that I just know is on the community's mind. So with classes moving to virtual, some extracurricular activities suspended, some families have looked at options for forming a social pod with a couple other families that they know have been following the right safety procedures as a way to offer some social options for their children. Is that something that is safe for CF families to pursue? And if so, what are some of the considerations that they should be looking at with those families?
That sounds like it's for me. So I'll just take that question. It's again knowing the people. So if you trust those people aren't out and doing kind of crazy things, it's okay. It's safe. Just like if you went into, and probably safer than if you went into a school setting where you don't know what everybody has been doing and where everybody has been. So to actually know your group, to do proper hand washing or the hand sanitizers, wearing masks throughout that time, that could be options for people so that they have an outlet and they have a change of scenery and they have something that actually is something they like. So I would say, again, that's knowing your environment, knowing the people, and I would say that would be safe.
Okay, thank you. On a related note, with sports canceled in some communities, what are options for outdoor activities that could be safe, if any, for CF community members?
I think
Well,
any sort of outdoor activity where you're getting fresh air is both good for your physical and particularly mental health. And finding just a way to do that safely, whether it's in the community park, walking down the street in your neighborhood, or even just being outside your own house, is just beneficial all around.
things to think of too is throwing a ball, things like that. You just want to prevent people from touching their face, and the mask can help with that, but touching their eyes or their nose, mouth with something that they've had in contact or been in contact with. So, and using hand sanitizers in between. So a park is great, walking, doing any sort of activity out there, as long as you have the hand sanitizers and even wipes. Sometimes you can wipe an area down and then you know it's pretty clean. So there's whatever you can think of is probably okay if you put the right protocols and the right sort of practices in place. So I wouldn't say to go into enclosed spaces at this point as much as possible. So I would say keep it outdoors to be safe.
Great, thank you. And what about college life? For a college student with CF, what are ways that they can seek out accommodations to make college life safer? And what are some of the ways that they can approach the university to make those arrangements?
So I think the first thing that they need to do, if they haven't already, is to register with the Office of Disabilities. That's something that really should be done during the application and choosing process of which school you want to go to. And I encourage all families to register with them regardless of whether they think they will need any sort of accommodations or not, because it's good to have that in place ahead of time and have everything prepared, rather than to go back and have to submit paperwork and kind of deal with an issue after the fact. So that would be the most important thing. And a lot of families don't necessarily understand how that works, so you can always just reach out to the school to ask about what they can provide. And I think it's important to know that they don't disclose details of your child's illness or anything like that to their professors. They're there to kind of handle situations as they arise. if there are any issues. So they still have their medical privacy.
The one thing to also remember is as you're actually the acceptance and if you're on campus, there are things that we can do from the CF Center that can actually help with a lot of that. We can write letters to say single room or suite with people they know. Even if you're a freshman, we can ask for accommodations that you're not going to use a public bathroom, things along that line. So there are letters that we can write to actually help with that. And also, if you're registered, and this would all go through that Office of Disability. So having that in place even before is going to be really important. If you find that you're in a situation that's already a problem, reach out to your CF Center, reach out to your Office of Disability, and that's where we can help, and they can help try and find better accommodations. Or if you thought it would work out with this roommate or that person, and it's not, that's just like any classroom. Reach out to the Office of Disability and just say, this isn't working out, I need different accommodations. So it may not happen right away, and then you just have to figure out how to put as many of those sort of precautions into action for yourself. But I know the schools are trying really, really hard to keep everybody on campus that are on campus, or maybe for next semester, get them onto campus. So this is any time will be the time to talk to them and to talk to your CF Center. That's really very important.
And similarly with people who are in like K through 12 school years, getting registered or getting the IEP or 504 plan in place now is really important if you don't already have that. There are just so many more precautions and special circumstances now with COVID-19 that might arise. And your school may be changing their procedures for cleaning. And if you don't have in your 504 plan that you have a child with a chronic illness that might need extra cleaning of the classroom or extra disinfecting or things like that, that's what that's for. So your CF Center can help write letters and send any needed letters or recommendations to the school directly. So reach out to them.
That's great.
Hi, I'm a caller on the phone. Could I ask a question?
Of course.
So grade school level sports leagues are reforming in our community, and we're very tempted to send our CFer to a soccer league. I wondered if anybody has any data about the likelihood of outdoor transmission between kids playing sports like soccer there is physical contact, and what kind of risk would we be taking if we let our child engage in that?
There's no data that we could, at least at this time, give you, but sometimes you have to weigh various things and say, this is going to be needed for your child to be able to really deal with all the stresses and deal with all the other things. So sometimes it's actually balancing. Talk to the coach, talk to the people that are organizing it, because then they can help put certain things into place. Part of the problem, no matter how, even though you're outside, just think about that cough and that you're on the phone. So you may not have seen the picture, but people have seen the picture and this, why we do 6 feet apart. Are they going to wear masks? That's one of the questions, because you will be in close contact. They will be in close contact. They will interact. You're not going to get around that. So it's not a sport that is separate like it would be like tennis, or even baseball is less contact. Soccer is more of a contact sport. So you have to just be careful that and know the risks going in. So nobody can give you exact data, but sometimes you have to weigh everything together. Unfortunately, I probably made it grayer for you instead of clearer or murkier, but I think you need to talk to the coach and see what's going to happen. How are they going to notify you if somebody does test positive, if a parent tests positive. What are they going to do in those sort of situations to then get your kid out of potential harm's way? Does that answer your question?
Yes, thank you so much.
So I like what Dr. Varlotta said about the balance between the risk and the reward of that. And, we do know that the better a child's mental health is and mental state is, the more likely they are to do their treatments and to keep on top of their physical health and their CF. So there is a balance and there is risk, and there might even be some flexibility where you could discuss alternative sports, like she mentioned with tennis and more solo activities. But it is something that there are pros and cons about it, and that it is a decision that you have to make with your family. And one of the tough things about soccer is you're not only dealing with the team that your child is on, but all of the teams that they play as well. And while your coach may be able to guarantee some sort of safety procedures, you can't necessarily expect that from other teams. And it's really just about how important is that to your child? What can you do to make it safer? Is this the right time to do it? And like Dr. Varlotta said, that there is risk to it, but there's also reward. So that it's a hard situation.
Thank you.
Yeah, thanks.
And I hope that answered your question, caller. And if anyone else is calling in and has a question, feel free to chime in. T, I had another question for you. You shared some great tips for things to look out for as signs of anxiety and depression in children. And of course, we know it's also important for our CF moms and dads to be looking out for their own mental health. So I wondered if there are similar things that they can look for in themselves. Are they the same things, or if there are any pointers along those lines?
So that's a great question, and they are very similar things. I think the most, if I were to pinpoint one thing to look out for, is, do you still enjoy things the way that you used to? Or are things more difficult to manage? If you're not enjoying things the way that you used to, that's a big change. And, people say, I just want to kind of get through the quarantine and get through the pandemic, and then things will be back to normal and we'll be okay. Signing up for therapy or to talk to a counselor is not a permanent, you're not signing, I will do this for the rest of my life. A lot of therapists just meet with people for a couple times, a couple sessions to help them get through a difficult time. So I think it's important to recognize you're not signing up for a 3-year contract of therapy. You can just be meeting with somebody once or twice, and even the mental health coordinators can really be there as almost like a flexible therapist that you can just call them when you need them. You can just send an email or just have a one session here and one there as needed. So definitely, do you still enjoy life the same way you did? Are your stresses outweighing the positive aspects of your life? The same way we talked about balance in kids' lives, balance in adult lives. Are there more positive things than negative things? Is a great way to look at it. I also just want to clarify one of the things, I put that list of symptoms to look out for in children, and I just wanted to clarify that kids don't always express distress in the same way that adults do, and a lot of those things might just come out as irritability. Depression in young children particularly often just looks like they're irritable and cranky all the time. So it might not look the way that you think depression or anxiety is going to look. And that's why it's important to really have those conversations with those feeling words like we talked about.
That's great. Thank you, T. Are there any other questions that people want to chat in, or I want to pause for a second in case someone that's on the line had another question? Okay, it doesn't look like there are. So I just wanted to once again thank you, Dr. Varlotta, thank you, T, and thank you, Yamini, for this really helpful presentation. This is just an unprecedented time, and it really means a lot that the three of you are willing to come together and help us navigate it. And I put up here as the last slide, in case you had a question that you just didn't get a chance to ask today, or if you wanted to follow up with some of the resources that Compass offers that Yamini described. Our contact information is here on the screen, and for those of you on the phone, you can contact the CFF Delaware Valley chapter at del-valley@cff.org or call us at 610-325-6001. And CF Foundation Compass can be contacted at compass@cff.org or 844-COMPASS. So thanks again, everyone, for joining us, and thank you to our presenters. And I just hope everybody stays safe and healthy out there, and we will be in touch with you really soon. Enjoy the rest of your day. Bye, everyone.
Thank you.
Thank you.
Bye.